is women who can take care of herself. Strong women, in any adjective word that explains a strong woman. And the reason that this is that we wanted to make sure that women who are unable to conceive or unable to, who are poor, who are uneducated, it's a way of empowering them and making sure that they identify this organization, which is sensitively, culturally appropriate organization.
Are you pleased with the turnout this afternoon?
Yes, we had a lot of turnout, yes. Our community organizers worked so hard, so we're pleased.
Bismillahirrahmanirrahim. Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alameen. Wassalatu wassalamu ala ashrafil mursaleen.
Hello, I want to thank the Somali Women's Infertility Support Group for putting us together here and bringing us to talk about what I think is a very important topic, not only for the Somali community, but really for all women and all couples. The topic infertility is a difficult topic to talk about, especially in such a public place. So we should really recognize the courage and the strength of the organization for being willing to have this conversation in such an open manner.
Chinese medicine has a very long history, few thousand years, and acupuncture is part of Chinese medicine.
Ultimately, though, if the patient's not trying to get pregnant, we want to try to control her pain. And this is where a lot of the controversy comes in when I'm talking with some of my Somali patients, because I want to put them on birth control pills to try to help the pain. Birth control pills help. Another medication called Depo-Provera, which is the birth control shot, will help.
Is it going to give me kids? Unfortunately, we can't solve the problem, but we can give you the strength to solve your problems. And that's the reason we recommend you to get help for depression. The sooner you get it, the better it is treated, and the happier you will be, and the happiness will return again.
We have to be able to stand up and stick our necks out and say, this is not okay. And a good example of that recently is the banking situation, in that a lot of the Somali community is not able to send money home. We should be able to send that money back. I think we're making some great steps, hopefully opening up a Somali bank sometime in the near future.
And so there is this dilemma of we have this great healthcare system that works good for the majority culture but doesn't work good for the minority culture. One of the things that we have to do very clearly and distinctly is make sure that when we build an exchange, that is the place in which you get your information. You have to be able to access that widely. The Minnesota health plan, often referred to as single-payer healthcare, goes further than even where the president goes. It allows everybody to completely be covered. The first thing we need to do is we need to support and fully fund organizations like Insuroon, right? And the reason why we need to do that is that these groups and groups like it that are culturally specific, that understand the people in which they serve, really help us, legislators and others that are helping to make the decision. It helps us make sure that we design programs that work.
Thank you very much for coming. Our meeting is